Elysium Exchange allows providers to access patient data within the community from any secure web connection.
For example, when a patient presents for the first time or is wheeled into an emergency department, the physician can make a query to the entire community to see what information may be known about that patient.
The Exchange retrieves and displays the patient information in a unified virtual health record, all while securing the patient information at the source systems. Emergency Department, General Hospital, 1 a.m. Catherine Miller is a 79-year-old woman who presents to the ER at 1 a.m. complaining of severe abdominal pain and fears that she has a recurrent tumor as she had a pelvic sarcoma 20 years ago. The physician logs into the Elysium Exchange and with the admitting nurse searches the Exchange for Catherine Miller. They view the patient summary in Catherine's virtual health record and note that she has an allergy to meperidine, Demerol. They note the patient's current medications and previous diagnosis of sarcoma. The physician reviews the prior hematology labs and graphs the platelets to quickly understand the trend. He also checks the previous reports to view the discharge summary for Catherine Miller. The ER physician suspects a colon spasm, but proceeds with a CT scan in view of her history of cancer. Time elapsed to log into Elysium, find patient record, review patient's problems, allergies, and history, less than 2 minutes. Later that morning, the CT scan is complete. The physician reviews the result, and it shows a small adrenal mass. The physician searches all reports for adrenal. He discovers 2 previous CT scans that note the stable adrenal adenoma. The ER physician is concerned that the adrenal mass could represent a new tumor. After using Elysium to review outpatient records, as well as search for any previous mention of an adrenal mass, he is able to reassure the patient that all is okay and sends a copy of the result to the patient's primary care physician.
He creates the note and sends it to Dr. Kennedy.
Time spent by Dr. Morningstar to drill down into patient history, forward results to primary care physician, notify other physicians of case management. Less than 2 minutes. Axolotl's practice-based Elysium EMR Lite allows physicians to quickly and easily view and manage patient data when and where it is needed. Home of Dr. Ted Kennedy over breakfast. Dr. Kennedy is attending a conference today and will not be in the office.
Using his notebook computer, Dr. Kennedy logs in to check his clinical inbox.
Starting with the first report, he selects Marilyn Ardell. He reviews the 3 brain studies and decides to defer this report until later. He selects the next report from his inbox. He reviews the lab result from General Hospital for Betty Austin. He decides to action this document to his medical assistant to schedule a follow-up visit ASAP and annotates the report with Reviewed by T. Kennedy. Having dealt with that report, the next report opens automatically, and Dr. Kennedy reviews the mammography report for Marilyn Berry and decides it is normal.
He clicks the Custom Workflow button to file the document and mail a copy to the patient.
He opens the next report to review Catherine Miller's visit notification from the hospital emergency department. The report indicates irritable bowel and a normal CT. He decides to review the next report to examine the lab results for Catherine Miller. He further reviews the urine culture and notes that the report indicates an infection. He decides to write a prescription.
He searches his personal drug list for Cipro and prescribes the 500 milligram tablets.
He notes the warnings and views possible interactions with drugs already prescribed.
He adjusts the prescribed quantity and then selects the preferred drugstore for the patient and saves the prescription.
When Dr. Kennedy contacted the patient, he asked her to come to the office. Because this is her 4th infection this year and she has had previous pelvic surgery, he elects to treat her with an antibiotic and make a referral to a urologist. Dr. Kennedy decides to order a urine culture to be completed before her next visit. He clicks to insert the appropriate billing information, Secure Horizons plan. He then clicks urine culture and indicates urine tract infection and adjusts the collection date. He saves the order and prints a copy for the patient. He quickly reviews her complete vitals in the tabular E2 view and proceeds to action the document to the Medical Records Department. He gives instructions to file the document and annotates it with treated with Cipro and referred to urologist. He easily navigates back to the complete list of results for Catherine Miller and selects her reports to forward to the specialist. He selects the specialty type, urology, and the doctor, Dr. Bloomington. He notes that this is a referral and forwards the reports to Dr. Bloomington. Dr. Kennedy returns to his awaiting action view to manage the remaining unactioned documents. He selects all of Catherine Miller's documents and clicks the Save Without Printing button. This removes the documents from his inbox, does not print them, but retains the documents for future access. Dr. Kennedy then reviews the next report, a radiology report for John Smith, and actions the document to be dealt with by his MA. He gives instructions to file and mail a copy to the patient and annotates that he reviewed the report. Time elapsed for Dr. Kennedy to log into Elysium, review reports, view images, write a prescription, order a culture, forward results to a specialist, and manage his inbox, less than 8 minutes. Elysium Exchange allows providers to access patient data anytime, anywhere, improving the quality of patient care.